This is our fourth session in this series of our seminar. I hope that you are learning something from every topic that we've been discussing each night. And tonight is an exciting topic, and I should say this is one of the most important topics that we should discuss, specifically here in the Philippines, because diabetes is already considered as an epidemic in our country. In fact, I have introduced to you at day one that Filipinos are highly affected with diabetes, and unfortunately, because of the chronicity of diabetes, because of its nature, people would always neglect their condition, and oftentimes they don't get themselves tested. And even if they get themselves tested, they don't, in fact, comply with the medications because they don't really feel physically ill. Okay, so because of the chronicity of the disease, you don't feel it doesn't bother patients so much, and so they won't put much attention on it. But let me say again that this is one of the scariest disease that anyone could have, because we also consider diabetes as the mother of many types of diseases. So it can brought about many different kinds of complications that you do not want to happen to you or to even to your loved ones. So, like I have discussed with you at day one, I have showed you this slide already that one in every five Filipinos are already diabetic or pre-diabetic. So, looking at the incidence and then the prevalence of diabetes in the country, and of course the projection of how many Filipinos will be affected with diabetes, this is really remarkable, and that every Filipino should be aware of how diabetes is developing and how can we prevent pre-diabetes from progressing to full-blown diabetes so that we can avoid complications. So if you noticed, now we already have the term, the diagnosis for pre-diabetes, because for the longest time we just tell our patients that their blood sugar is at the borderline, but now we already put a diagnosis for pre-diabetes, and we already have guidelines in treating patients with pre-diabetes, because evidences are showing us that complications in diabetes are already starting, or the onset is already beginning at pre-diabetes stage. So that means you don't need to wait until you develop full-blown diabetes before this complication happens. So unfortunately, oftentimes patients would visit doctors for consult who have diabetes. According to studies, most of them are already having 50% reduced function of their pancreatic B cells already. So that means their beta cells in the pancreas are not producing enough insulin anymore, to provide a good function for the regulation of the sugar in the blood. So as you can see here, Philippines is ranked fifth diabetes hotspot, and this is in Western Pacific region. So this is no joke, because diabetes is not only affecting adults, but this is equally affecting children at the same time. It's just that we don't get our children tested. We don't bring our children to get tested for diabetes. We just thought they are still a kid, they can tolerate sweets, they can eat whatever they want because they are kids. And unfortunately, to young people at the same time, sometimes they feel they are immortal, that they don't get any disease, and so they can do whatever they want, they can eat whatever they want. And us parents, we don't think that they need consultation or they need screening. Okay, so that's also one of the challenges and the barriers in the Philippines, because not all patients are actually going for routine screening, for diabetes. So you can see that there is a clear epidemic of diabetes in the Philippines. Now it's important for us to define diabetes, and we can only do that using these numbers in your screen. So you need to know what normal blood sugar is, and then we have to know what pre-diabetes is and what are the numbers that will describe and that will define diabetes. So again, you'll never know your markers unless you get yourself tested. So a puncture of the needle is really necessary for us to get a sample of your blood, and then we bring them to the lab and then get yourself tested. Okay, so your fasting blood sugar is really necessary for us to begin with the diagnosis of diabetes. So the normal blood sugar should be below 100, and that's the goal. And the moment you reach 100 milligrams per DL, or that's about 6 to 7 millimole per liter, so that means you are already pre-diabetic. And so treatment would start at that stage already. So our goal with pre-diabetes is for you to reverse your condition, because we really have a good news in terms of reversal for pre-diabetes and some patients with diabetes as well. Now, if your blood sugar reaches above 7 millimoles per liter, so that means you are already diabetic. So we need to findings of this number so that we can say and diagnose patients with diabetes. So we also use this same measurement to monitor patients in terms of the treatment that we are providing them, like the intervention that we prescribe for them, to make us aware that the program and the treatment is working for the patient. So there are other tests that we do for diabetes, but this is the basic one that you can ask at the laboratory in cases like doctors are really far from you. So you can start off with your FBS. Now, if you can see that there's something wrong, there's an abnormal finding, then we highly recommend that you visit your physician so that they can initially start working on your condition. Okay, so let's say you don't have a laboratory close to you and you don't have doctors close to you. You can also look at some of the symptoms. These are classic symptoms of diabetes. So we borrowed the slide from CHIP. This is Complete Improvement Program. So this is one of the intensive therapeutic lifestyle program that we use in lifestyle medicine in helping patients get rid of chronic diseases. So again, going back to diabetes symptom, classic symptom includes frequent urination, feeling thirsty, increased appetite, so blurring of vision, and then they feel always tired. So typically diabetes are always hungry, they're always thirsty, and then they are always sleepy. Okay, so if you notice those symptoms happening to you or anyone in the family, so maybe that's the right time for you to get yourself tested and you go for consultation. Now I want to discuss here very, very briefly for you to know what's happening with diabetes. I want to show you here the function of your normal pancreas. Now, every time you eat anything with sugar, say for example, if this is rice or spaghetti, when you eat them, your pancreas is producing insulin so that the sugar that you can get from those food can be utilized for energy so that they can go inside your cells. Now, your insulin would act like keys so that your sugar can get inside your cell, so they don't stay in your blood vessel, because that's the problem. Whenever your blood sugar stays at the blood vessel and then they don't get inside the cell, then it causes the complications. Okay, so here you can see in a normal person there's a lot of key. That means there's a lot of insulin, and so the insulin can open the gates of the cells, and so that sugar can get inside the cell. So that means they don't stay in your blood vessel. However, in patients with type 1 diabetes, their pancreatic B cells are not functioning, so they don't produce insulin. So that's why they are insulin dependent. So they get in injections or they get a device so that it can replace the function of the beta cells of the pancreas. Now, with type 2 diabetes, which is composing over 90% of the diabetes in the entire world, usually patients are overweight, and then their pancreas are actually working very, very well. Unfortunately, in these types of people, it's either they get too much of the sugar, and then they eat too much of the fat, and so the culprit in type 2 diabetes is in fact insulin resistance. Now, what's happening here is that your pancreas is producing enough amount of your insulin, but unfortunately there must be something gumming up on those doors in the cell so that the insulin is not working properly, and so that the receptors will not work properly. So here in this slide, I am showing you that the sugars are actually outside the cell. They are in the blood vessel, and we have there the receptor. The insulin is here. The pink colored substance here is the insulin. They get into the receptor, but again, the door is not opening up because of the fats inside the muscle cell. Okay, so this intramyocellular fat are the ones causing insulin resistance. So this causes the buildup of sugar in your blood vessel. They don't get inside your cells to be utilized as energy. So that's why you will notice patients with diabetes, they always lack energy because the sugar that they supposed to have and they are supposed to utilize is right there at the blood vessel. It's not inside the cell for it to be utilized as energy. So that's how important it is to talk about fats again, because here in the study, you will see that in fact, the free fatty acid elevation in your blood will in fact inhibit your insulin-stimulated whole body glucose uptake after 160 minutes of your consumption. So that's why in diabetic patients, we always say every meal counts. It's just the same thing with hypertension. It's just the same thing with heart disease. Now, if you would recall, since day 1 and then day 2, day 3, and now day 4, we're still talking about fats here, right? So fat really has something to do with the development of chronic diseases in general. So here, this is already diabetes. When we consume free fatty acids from our diets in just a matter of 160 minutes, they can already initiate insulin resistance, which is the culprit of diabetes type 2. And so now we know that it is insulin resistance that's the problem in diabetes type 2. And so this is a good news because we can do something about it. If we can control and we can reverse insulin resistance, that means your blood can uptake your blood sugar again so that you can reverse your pre-diabetes or your diabetes. So diabetes is a complex condition. Yes, we can provide patients with medication so that we can induce the pancreatic B cells, for example, to produce more insulin, but we're not in fact addressing the cause here. Now, what's good with diabetes is that the moment we implement what is recommended in the practice guidelines for the treatment of diabetes and pre-diabetes, we can help patients reverse or achieve remission in their condition. So here in the guidelines that I'm showing you, in fact, I've showed you this already during day 1 in our session. You will see here that the intervention and the foundation of treatment for patients with pre-diabetes and diabetes is lifestyle modification. Before we even give patients medication, we implement lifestyle intervention. We counsel patients and we motivate patients to start modifying their lifestyle, because food has something to do with the development of their diabetes, in the progression of their diabetes. It's not only the food, but having sedentary lifestyle and having a stressful condition in their lives will in fact determine the progression of their diabetes. So again, since this is a complex disease, even if we provide our patients medication, say let's start with 1 pill, and then we do not motivate patients and we do not implement lifestyle modification, tendencies are after several years, we needed to add another medication to the patient. So what you will realize is that you would start with 1 pill and then eventually we will add another pill. Now you're taking 2 pills, and then eventually we will add another pill. Now you're a triple therapy, and then eventually you will end up taking insulin already. So if you do not want to develop that case to you, if you do not want to progress your diabetes, then this is the right time for you to start having a good mindset on what you can do to reverse your condition and to help yourself. So like I said earlier, I want patients to realize that diabetes is a scary disease. Now, looking at the complications that diabetes can give you, it's not totally worth it. There are over 80 patients dying of diabetes every single day, but diabetes can actually result to stroke, they can induce heart attack, they can affect your peripheral arteries, they can affect your eyes, they can develop cataracts, they can develop glaucoma, you can develop diabetic foot, diabetic nephropathy, diabetic neuropathy, so on and so forth. So that means if you have diabetes, as long as you have blood vessels on those parts of your body, they can be affected. Even your skin can be affected with diabetes. So I mean, this is really a good time for people to be aware of what diabetes can bring to them. So yes, those sweets will temporarily satisfy their cravings, but the long-term effect of those sweets and those fats that you just ate and you keep eating is not totally worth it. All right, so this is a progressive disease that's affecting a person from head to foot. So why am I saying that diabetes and your feet? So this is actually the title of our session this evening. So like I said earlier, it's not only the food that you put inside your mouth that is influencing the development and progression of your diabetes, but the onset of diabetes is also related to being sedentary. So that's why here in treating patients with diabetes, we need to have a balance between the dietary intake and the physical activity of a person. We have to implement good physical activity. We have to motivate patients to have a very good physical activity, moderate physical activity, at least 30 minutes every single day. That's the optimum level. But at least if they can do 150 minutes of moderate physical activity, then that's already best for them, because physical activity may have the same effect of the metformin that we are prescribing you. So that's why we really do not allow, or we really discourage patients not doing exercise for maximum of 2 days, because the insulin resistance is creeping up. And then if this is coupled with a faulty diet, a diet high in saturated fat and a diet high in sugar, refined sugar in particular, then what's going to happen? Okay, there will be an increase of your blood sugar in the blood, and when we reach the plateau in the blood, that means that's the time that your blood sugar is up, it's not going down, then complications may happen. Now in this slide, you can see that every time a person would consume 40 grams of fat, that will increase the risk of becoming diabetic for about 6 folds already. Now it is really nice to know where we get our calories from the fats. Now you will find here in the slide that I'm presenting to you now, that there are so much things that people would eat every single day that is mostly composed of fat. So here's a very good example. Say you're eating beef sandwich steaks. So we thought this is lean meat already, but unfortunately, if you look at the calorie component of this is 70% calories coming from fat, for example. All right, so that's how important it is to look at the food choices that we serve people with diabetes. Now, I want to emphasize here one more thing, which is nuts. Now, you will notice that nuts are about 80% fat in terms of calorie. And so even patients with diabetes, we highly encourage them to consume about a handful of nuts every single day. Okay, too much of it will provide them enough amount of fat at the same time. Now here you will see this is another worst thing that you can eat, you know, if you're a diabetic person. Now if you consume about 4 ounces of unprocessed meat, this will increase your diabetes risk by about 20% already. However, if you take about 2 ounces, this is only 60 grams of processed red meat. So for example, this is your meatloaf, so this is your corned beef. This will increase your diabetes risk at about 50% already. So this is a result of a systematic review and meta-analysis that was already published in 2010. But again, we want to dwell with the good news, okay? Now here in this study, you will see that replacing 1 daily serving of processed meat with whole grain dish will decrease your risk of developing diabetes to 35% already. So that's how easy, you know, to help patients with diabetes. We just have to encourage them, and first is to educate them on the food choices that they have. Now, the first goal in reversing prediabetes and diabetes is for patients to achieve their ideal body weight. So normally and most probably patients with type 2 diabetes are already overweight or they are obese. Now, don't get me wrong, because there are other patients who are not obese. They are at their ideal body weight, but unfortunately they are developing central obesity, so their bellies are actually the ones storing much of the fat. So our goal here is for them, in fact, to reach again their ideal body weight and then reverse their abdominal obesity. So our first goal here is to modify their food intake. Now I want to show you here one of the famous studies, and this is the Adventist Health Studies. Now you can see here that the moment you consume more plant-based diet, most likely you will reduce weight. And in this study, it shows here that the more you get into plant-based diet, the lesser your weight. This is for female and this is for male. Now, in this study, you will see a very clear relation of diet and the development of diabetes. Now, you will see here that diabetes is higher among non-vegetarian and diabetes is lowest among total vegetarian. So that means the more vegetable you take, the more whole food plant-based diet you take, the lesser the chances or the risk for developing diabetes. Now, this is a landmark study in terms of looking at meat consumption and the development of type 2 diabetes. This is the EPIC study. Okay, so this is about over 1600 sub-cohort on type 2 diabetes. Now, they were able to find out that in every 5% of calories from animal protein that you take, this will result to about 30% increased risk of developing diabetes. And then in this study, they also found out that vegetable protein is not associated with increased risk of diabetes. So with the evidences that I just shared with you, you will see here a clear inclination of our dietary choices with the development of diabetes. Now, if we just have a clear realization on what's happening in our daily lifestyle here, especially people living in industrialized country, living in the city, you will notice that people are always eating out. People are ordering food from outside sources, from the restaurants, from fast foods. And then even if we prepare our food at the house, the food preference, and then the things that we serve our family are in fact composed of lots of saturated fat, lots of refined sugar. And this only goes to show that nutrition literacy among Filipinos is really low. And that is the goal of our seminar, our daily seminar. And this is to inform you of the food choices and the food preference that people should have in cases like they are at risk of developing chronic diseases such as diabetes. And of course, we have to couple dietary choices with good physical activity. So we have a very strong campaign on physical inactivity, and in fact the world now is suffering from inactivity crisis because everyone is just working while they are on their chair. Okay, so people love sitting, people love sleeping, and they hardly walk already, they hardly exercise already. In fact, every time I would ask my patient if they do exercise, for them it's really hard because you have to schedule your exercise. But the moment you use the term physical activity instead, for them it's kind of doable, it's kind of feasible. Okay, so we always mention increased physical activity. So that means do not allow yourself to sit over an hour. Say if this is already 45 minutes or so, you have to stand and you have to stretch and you have to walk a few steps, and so that you can help yourself have good circulation, and so that you can utilize those calories that you just ate. So our goal here is for you to have a good physical activity and every single day, and this is 30 minutes moderate physical activity with strength training. So that means you're using weights. It doesn't have to be at the gym. You can use many different ways to use even your own weight to do physical activity, right? Okay. So this is the right time for patients with diabetes, patients with pre-diabetes, or have family history of diabetes to think twice. This is the right time to start changing and modifying your lifestyle, because studies show that the earlier we implement this dietary and physical activity, lifestyle intervention in general, the earlier we implement this, the higher the chances of reversal of diabetes and pre-diabetes. So I have here some videos to share with you. These are very, very good example of some physical activity that you can do at home. Having bad climate is not really an excuse. This is a seated exercise that I have seen from YouTube that I want to show with you here. This can be done by anyone, any patient with diabetes. So even if you're an elderly, you cannot go at the park and do your exercise, or you cannot jog anymore. And this is really good specifically for patients who are overweight and who are obese, because if you're obese and if you go for a long walk and say jogging, it will damage your knees. So we highly encourage them to do seated exercise to start with. So I hope the next material will be useful for you. You can search a lot more about this at your end, and so that you can also incorporate this in your daily physical activity. Now, another video here that we will be playing is a recipe coming from Culinary Medicine or Culinary MD Asia. So this is sharing you another recipe you can start at home. So how do you make a tweak, and how do you improve preparation of plant-based ingredients so that you can actually come up to a very good recipe that is palatable and that is delicious, and so that you can sustain your new healthy lifestyle. Today we will have this Teaching Kitchen episode, and I am Dr. Michelle Palma. Together with me is my assistant, Margaret. Today we will be learning some of the recipes that we will teach you. This is repurposing food. Again, when we mean repurposing food, is that using your food as medicine. So I promise that today we will be preparing some of the foods that we used to eat. It's just that we will be giving you healthy substitutes. Alright, so as you can see in our table right now, we will be preparing 4 recipes. Okay, so now we will be making banana blossom patty. This is a very nice substitute for any burger made of meat. Okay, so this has no saturated fat, and this is full of fiber that is really absent in any burger patty that you can find in the market. So our ingredients here are the following. We have 1 cup of banana blossom cut. This is fresh banana blossom, and this time of pandemic, you can actually keep your banana blossom. I had this for over 2 months already, and it's in my fridge, and it's still good, and we can still use it. So here, first we have again 1 cup of banana blossom, and then we also have 1 cup of oatmeal flour. So it's very easy to create your oatmeal flour. You just have to put your oatmeal, whatever source you have in your pantry this time. It can be your quick cooking Quaker oats, or it can be your rolled oats, okay? So you just have to put this in your food processor and then blend them, okay? So until you get the consistency like that of a flour. And then we also need 1 tablespoon of spring onions chopped. We also need 1 tablespoon of tomatoes. This is diced tomatoes. And then we also have here 1 tablespoon of onion, diced onion. And then we have 1 tablespoon of garlic, minced garlic. And of course, we have a bit of a water, okay, just to have the good consistency of the patty that we need, okay? So we only need a bowl like this to mix all the ingredients, and then we just have this spatula to mix all the ingredients. All right, so Margaret, maybe you can help us out. So here you just have to pour banana blossom, and then next here is our oatmeal flour. Okay, thank you. And then we have the spring onions, everything there. Okay, and then we have the tomatoes, and we have the onion, and we have our garlic. Okay, so this is very easy. Just give it a good stir to combine all ingredients. And then this is the right time for us to add our water. Okay, good. So you just have to look at the consistency if it's already okay with you. If it's not, then you can add more water into it. And then this is the right time for us to add then the rest of the ingredients, which is black pepper and then salt, just to season it. Okay, so here we season it with black pepper. Sometimes it's really nice to have your patty a bit spicy. So you can use your black pepper to do it and then season it with salt. It really depends on how salty you want it to be. And then just mix them all together. And now this is ready. So you have two options. You can either throw this to the oven. Of course, you have to preheat your oven to about 250 degrees centigrade and then just place it there. And it will cook depending on how thick your patty would be. It could cook in about 15 to 20 minutes and you're done. So that is zero oil, okay? So no fat at all. But if you don't have oven in your house right now, you can just fry it. You can also use non-stick pan, but if you don't have non-stick pan, then you can put some or a little bit of an oil and then fry them, okay? Like if you have a lot of banana blossom, because there are areas in the Philippines right now that has lots of banana blossom, you can also cook this by batch. All right, so that means you may prepare a lot of this, and then you can also put this in a steaming pot, and so you can steam them, and then you can preserve them in the fridge. It can stay for over a month. So here we have the patty ready, and then we will put this in the oven. Or another thing is we can fry this over the pan. Alright, so while our burger patty is in our oven, while waiting for it, this is the right time for us to prepare our vegan mayo. Okay, so the only ingredients that we will be using, first we have 2 blocks of tofu, and then lemon. We wanted the juice, 2 tablespoons of brown sugar. This is optional. Whatever kind of sweetener you may have, you may use your honey, agave, or maybe dates to also do. And then we also have dash of black pepper, and then we also have 1/2 teaspoon or 1/4 teaspoon of your salt, depending on the saltiness that you like. Okay, so in this recipe we only need a bullet blender, or any blender will do. Okay, so we just have to put our tofu here in our bullet blender. So ideally we have to if your blender is not industrialized, then you have to mash your tofu first, although this is not really so firm and it can be managed by a bullet blender. So you can always buy your tofu from the wet market. You can buy this from the grocery store, or if you want, you can also make your own tofu from scratch. So watch out for the upcoming episodes that we have in our Teaching Kitchen, because we will be teaching you how to make your own tofu at home. So this vegan recipe is so simple. Once finished, you can store this in the fridge, and this can stay for over 2 weeks, sometimes 3 weeks, depending on the temperature that you have in your fridge. Okay, so we have our tofu here right now, and so we just need our lemon juice. So approximately you will be needing about 2 tablespoons of your lemon juice in this recipe. So this will provide you the sourness. Okay, next here is we just have to add our sugar. And then, of course, our black pepper and our salt. Now, we also have here optional ingredients. We have here nutritional yeast. This will give you the cheesy-like taste. If you don't have this in your pantry, that's not a problem. Again, like I said, this is optional. So you can put about 1 to 2 tablespoons of this. And then another optional ingredient here is oil. You may use olive oil, extra virgin oil, pomace olive oil if you are intending to make this stay for over 3 weeks. But if you're going to use it right away, then you don't need to put oil. Okay? So in this time, I'm not going to put oil. And then another ingredient that we may use here is plain mustard. Okay? So if you want that bitter taste in the vegan mayo, then we can add mustard to it. Then we just have to throw this in the blender. Yeah, it's there. let's check. So this is just the right texture that we want for a vegan mayo. Okay, so after 15 minutes, our burger patty made of banana blossom is already ready. So again, like I said earlier, you can cook them over the pan or in your oven, okay? So here we have our banana blossom patty. Okay, so you will see the consistency when it's cooked in the oven. It's kind of dry, but if you want it to be juicy, then it has to have some oil, right? So, but we're getting rid of the excess oil. So the best method of cooking is putting them in the oven. All right. So here we will be making the clubhouse sandwich. So of course we will be needing the bread, and then we have the lettuce with us. And then you can also put some onions and then your tomatoes, or if you have some cucumbers, you can use them as well. All right. So, and then we will be needing the vegan mayo that we just created earlier. So here's the vegan mayo that we made earlier. So we need this in creating our vegan clubhouse sandwich. All right. So first we just have to assemble. We have here our bread, and then we just have to put the vegan mayo. Just put your desired amount. It can be as thick as you want or as thin as you want. So there are some options where you can improve your vegan mayo. You can also add some cucumber relish if you want to add some sweetness to it. But this one, plain vegan mayo, is already good enough. All right, so we just have to put there the mayo. And then the next thing is to put our lettuce. Margaret, maybe you can put here the patty. One patty over there. There you go. And then you can put some tomatoes. And then the onions. One more. All right. And then another pair of bread with the mayo. And this is so simple. Put it right there. Okay, and then we just need to cut the sandwich. This is optional again. If you're gonna eat them as a whole, then that's not a problem. All right, and then we can serve it here. So there you go. We have our clubhouse sandwich. The next recipe that we will make here is a very simple sweet potato wrap. So we have a lot of variations in serving your salads, remember? So sometimes if you eat salads 3 times in a day, it's really necessary to have some strategy and to be artistic enough on how to use those ingredients and how to feed them to your family. So this is one very simple way to tweak some of those recipes. So you just have to have all the salad ingredients you have and put them in a wrap. But where do you get your wrap? Usually we buy it from the department stores or from the grocery store, right? So all of those has, of course, they have preservatives because just to have a long shelf life. But again, you can make your own wrap in the house, just having 2 ingredients. And what we have here is any type of sweet potatoes, and then you have your oatmeal flour. Okay, so it's just like the oatmeal flour that we used earlier. Now, if you don't have oatmeal in the house, then you can use any types of flour that you have in your pantry. Okay, so basically we just need equal portion of your sweet potatoes and an equal portion of your oatmeal flour. All right, so we just have to put our sweet potato here, and then we just have to mash it. Now remember that the sweet potato should be boiled so that we can reach a soft consistency as much as possible. It has to be soft and not dry. All right, so you just have to mash the sweet potato first before you add your flour or your oatmeal flour. you're eating this kind of wrap, Margaret, right? So here, this is just ready. And then we add same proportion of your oatmeal flour. And then if you think you need some water to be added, then you can add some water. All right, and then the next thing that we're gonna do here is to knead the sweet potato mixed with our oatmeal flour. Okay, so I think we just reached the right consistency, and this is ready as a dough. All right, so in this stage, we need our hands here. Okay, you just have to make a dough out of it. All right, so we already have the dough here. You just have to make a good consistency of your dough. And then, of course, we will be needing your board and, of course, your roller. And we will be also needing portion of your oatmeal flour because we have to make a shape of a wrap. So I'm only making one wrap here. And we need the roller. So you just need to dash some of your flour on the board so that it won't stick on the board. And then until it reaches a consistency of about 2 millimeters thin, okay? So it's just plain and simple. We don't add any salt, we don't add any sugar, no preservative at all, just 2 ingredients. No oil at all. So again, like I said earlier, if you think your sweet potato is a bit dry, then you have to use water. But in this case, it's just okay. And so as you can see, we didn't add any water. So be careful not to add too much of a flour. Otherwise, your wrap will be hard, you know, when you cook them. So we want it soft as well. Okay, so here, just about 1 to 2 millimeters thin. And then we have to throw it in the pan and just cook it right there. No oil at all. So when we put it in the pan, we just have to make sure that we have to flip it every 1 to 2 minutes. So here you can choose to use your non-stick pan, or any stainless pan will also do. Okay, so this is the way you cook your wrap in a low temperature. Most probably in about 1 to 2 minutes you will be flipping it over, and then in about 5 minutes you will be done. Okay, so but if you want to make a potato chips out of the same ingredients, then you can chop this into whatever forms you want and then put them on the pan and then just cook them the same way. But this should be longer, all right? So until we reach the consistency and the crispiness that you want. Okay, so we have here finished product. So we have here the sweet potato wrap, and then we also have the sweet potato chips. Okay, so this time we will assemble our salad wrap. So we have our sweet potato wrap already ready here. So earlier we made our vegan mayo, if you remember. And so another ingredients that we need here are diced tomatoes and then diced onions. And then we will be needing our seaweeds here, and then our lettuce and any leftover viand you have in the house. So this one I have here, this is vegan afritada. So this is made of gluten, but you can also use the banana blossom patty that we had earlier. You just have to chop it into small pieces so that we can add this into our salad wrap. Okay, so we just have to assemble. We have here our sweet potato wrap, and then we just have to put here our mayo, just enough. Okay, so just spread it around. Okay, and then we just have to add our tomatoes, and then our onions. So for kids, they don't really like onions, so you can skip them. And then we just have to add our seaweeds here. So this will add up umami taste in your wrap. And then of course we have to put our leftover any vegan viand that you have. So if you have tofu, then you can use tofu. If you have your like the banana blossom patty earlier, we can use them as well. And then lastly, we can put our lettuce over. So you just tear the lettuce right size, and then we just have to wrap it. So you can also use a toothpick to keep the wrap. As simple as this. There you go. We have our salad wrap. Okay, and the last recipe for today is mulberry juice. So we have very simple ingredients, again, coming from our own garden. Okay, so except for one, which is lemon. So we have here lemon juice, we have the mulberry, the fruits, and then we have mint from the garden. It really depends on how minty you want it to be. And then this is an additional and optional ingredient. Any form of sweetener will do. If you have honey, you can use honey. You can use brown sugar, muscovado, cocoa sugar, or no sugar at all. Okay? So we will not use sugar. So all you need to do is to put some water in your blender, and then we just have to add the rest of the ingredients. Okay, so we just have to put our mulberry. Of course, you just have to wash it first and then put it here. You can put as much as you want because this is already sweet as long as you harvest them right. Okay, so there you go. We have our mulberry, and then we can add some mint leaves, fresh mint leaves. Again, this can be optional because you may not have your mint at home right now, but I really advise you to plant some mint. It's really easy to propagate this. You just have to buy one pot, and then you just have to cut and then plant them, and it can propagate very easily. Okay, so we have just enough mint here, and then we have our lemon. So we squeeze the lemon juice. All right, and then we throw this to the blender. Again, if you want your sweetener, you can add any sweetener. But in this case, we're not using any because our mulberry here is already sweet enough. Okay, you just have to blend like about less than a minute, and then we're done. So just remember, whenever you prepare your juice, you have to consume it right away. Or otherwise, you have to add some ice to preserve the antioxidants, to preserve the anthocyanin that has in it. Okay? Okay, so here we go. This is our mulberry juice. You can easily propagate your mulberry tree. You just have to find the cuttings, and then you just have to plant it. In less than 6 months, it will give you very nice fruits, and this will be whole year round. So here you go, your naturally produced mulberry juice. Always remember that living a healthy lifestyle is the cheapest way you can provide yourself the best medical health care. Consider taking your baby steps towards a healthy behavior change, because having a disease can lead to crisis and potential disaster. We'd like to see you again in our next episode. Quality Life, your choice.
Hi, I'm Coach Nicole from SparkPeople.com. In this short video, I will lead you through a core workout that you can do right from a chair, and you don't need any other equipment at all. For your chair, ideally you want to use a chair that doesn't have wheels, but if it does have wheels, put them in a locked position for safety. And hopefully your chair also doesn't have arms at the side. That way it won't get in the way of our range of motion for our exercises. So to get started, we're going to scoot ourselves up to the edge of the chair, far away from the chair back. The feet are down on the floor, right underneath those ankles, about hip distance apart. Take your hands to your thighs and we'll begin to warm up the spine. Take a deep breath in, lengthen tall. On your exhale, curve your spine toward your chair, tuck the chin in. And on your inhale, reverse that, arching through the back and widening through the chest. Let's try it again. Exhaling to round and inhaling to arch that back, sit tall. One more time with each of those. Rounding, then arching. And then I want you to come back to neutral. Bring the arms up right next to the ears, and we'll get a little more mobility through that spine. We're going to lean forward over the thighs, and then out to the side, just circling the torso. Continue in that same direction, rounding as you go down, and as you sit up, arch that back a little bit and open through the chest. One more time, shoulders are away from the ears, and just breathe steady. Bring it back to center, and we'll reverse it. So we start leaning down to the thighs, go out in the other direction. Making sure those elbows are really wide. And again, deep breath. And inhale, lengthen, arch that back slightly at the top. One more time here. All the way back up and pause at the center. For our next exercise, we're just going to start engaging through those abs. You can just take your hands to your thighs, sit as tall as you can with the shoulders back. You're not going to see any movement on this exercise, but you're going to feel it. So take a deep breath in, and on your exhale, I want you to pull your belly in as tight as you can. And then on your inhale, go back to that starting position. So it's an exhale, the navel pulls toward the spine, but we're not rounding, we're still sitting tall. And inhale, release it. Imagine that someone's about to punch you in the stomach and you're bracing for it, really engaging those abs. And inhale again. This is a great exercise that you can do, even just sitting at your desk at work, to work those abdominals a little bit. Let's try it one last time. Deep breath in. Exhale, pull that belly in, continue sitting tall. And release. Now we want to feel that same sensation on these next exercises. So the abs are pulled in and we've got the hands on the chair right in front of us. Single leg lifts. Work through your own range of motion. Starting on one leg, lift the knee toward your chest and lower it down. Notice nothing's happening in my spine or my back here, but you really need to focus on the effort coming from that belly and not the leg. Okay, so two more here. Exhaling to lift, inhaling to lower. One more like this. Continue right here, but if you can work harder, lift the hands away from the chair. Exhale and inhale. Focus on the intensity coming from that belly. Every one of those exhales, you're pulling it in a little bit tighter. Two more times like this. We're going to add a rotation after this one, and you can do that with your hands still on the chair or your arms up. Here we go. Twisting toward that thigh and then bringing it back up. Notice we're still sitting tall. I'm not leaning toward that chair back at all. That's what's going to really help us engage through the core in a seated position. Two more here. Elbows are wide, shoulders are down. Exhale, twist. Bring it back to center, hands back down to the chair for the other side. Brace with that belly, exhale, lift the knee, and lower it down. Now I want you to work through your own range here where you are lifting your leg as high as you can while keeping the effort in the abdominals. If that's just a couple inches off the floor, that's fine. 2 more like this. Continue using those posture muscles, widen through that chest. 1 more like this, and if you can work harder, we'll bring the arms up away from the chair. Exhale to lift, and inhale to lower. Think about that belly bracing as if someone's gonna punch you in that stomach like we practiced earlier. 2 more times, you brace on the lift to keep the work in the abdominals. 1 more here, let's add that twist for our final 5. Exhale, twist, and inhale back to center. Again, through your own range. Make sure it's coming from the waist. It's not just the upper body or the elbows twisting, okay? Focus on the sides of the waist doing the work here. 1 more time. And now we're gonna do that twist side to side. So back to our first leg, twist toward it, back to center, exhale, twist to the other side, and back to center. Let's try a few more repetitions like this, alternating sides. And if you get tired, you can keep your feet on the floor and just do the twist to work through those obliques a little bit. And remember too, on all of these moves, the less weight you put into the legs or into the feet and the floor, the harder you're working through the core. So if you wanna come up to those tippy toes and just barely tap your foot down, you'll be working harder. Let's do 1 more set to each side. Exhale, twist, and inhale, center. Last one here. Back to center, and bring those hands back down. We're gonna try it with both legs now. Back to that tall position, hands down onto the chair. Brace through the belly and focus on the work coming from here. Take a deep breath in. On your exhale, we'll lift both feet up, and then release it down. It's a lot harder doing both legs instead of one. You're working through that core a lot more. It's okay if you need to lean back a little bit on this one. Just make sure you're not slumping into the chair. You're keeping your chest wide and your back nice and straight. And your movement might be a little smaller on this one too since it's more intense. Just do your best. You can rest your feet or just barely tap them or hover above the floor. 3 more times. Exhale and inhale. Here's 2. Last one, deep breath. And release it down. Good. Let's go ahead and sit up nice and tall once again. We're going to bring the hands up back to the ears again. Elbows are wide. Laterally flexing the spine. So I'm going to crunch the side of the waist down on the left side, back up to center, and switch. Crunching down and back up. So notice how I'm not allowing the back to round or my chest to collapse toward my thighs. I'm keeping it nice and wide the whole time. The movement we're focusing on is your shoulder reaching toward your hip, making the side of the waist a little bit smaller. I want you to focus your intention there through the center of the body and the sides of the waist on that dip side to side. Exhaling and inhaling 1 more time to each side. Good, keep breathing there. And back to center. Now we'll take the arms out to the side and we'll reach side to side. I want you to keep those hips planted. They're not gonna move at all. Using just the waist. Reach to one side, pull it back in, other side. So notice how my hips are locked into place here. It's almost as if my lower body is stuck in some concrete. I'm not allowing my hip to lift off the chair, and my hips aren't traveling with me. I'm focusing on the waist on up, okay? Exhaling to reach and then pull it in. Let's try just a couple more there. Think about your fingertips reaching to opposite sides of the room. 1 more set, shoulders are relaxed, reach, pull it in. Last one here. And bring it back in. Fingertips back behind the ears once again for a little rotation. We're gonna twist to the side, bring it back to center, and switch. So we did this earlier with that leg lift. Now you have an opportunity to focus a little more on that waist. I want you to still imagine the lower body is stuck in concrete and it can't move. Your hips are not rotating with you. And it's not the upper body working either. All the rotation is coming right through that middle part of the waist. And your arms, your chest, your upper body is just following where the turn of the waist takes you. 1 more time to each side. Inhale, center. Last one here. Inhale, center. All right, we're almost done. Let's take the hands back to the edge of the chair. Sit it nice and tall. I want you to have plenty of space behind you and your chair back. Bracing with those abdominals once again, shoulders down and back. We're going to inhale and lean with a straight back as far as you can in good form. Exhale, use the abs to sit back up. So if you can lean all the way to that chair back, fine. But if you can only lean a few inches or so while maintaining good form, then that's where you stop each time. So we have that bracing feeling around the torso. And we're really focused on the abdominals doing the work here. I want you to imagine you have a steel rod through your spine. So it can't bend, it can't flex. You're only going as far back as you can without bending that rod, okay? Couple more. Inhale and exhale. Last one here. Inhale, try to hold it there. Pull that belly in nice and tight. Breathe into the rib cage. And then exhale, pull yourself back up. Now our last exercise is to try to work through the lower back and the muscles supporting the spine on the back, which is kind of challenging to do from a seated position, but we're gonna do our best. So feet are about hip distance. If you need to make more room for your body to bend forward, take the feet wider. We're gonna bring the hands to the edge of the chair to start. Abs in tight, steel rod is still through your spine. So from here, we'll lean forward with a straight back. Focus on the muscles on the back to pull yourself back up, okay? So leaning just as far as you can without rounding your spine and your shoulders, and then pulling yourself back up. On exercises like these, we move in a really slow and controlled way so that we're focusing on doing it well and really honing in on the muscles that we're trying to activate. So I want you to think about the muscles you're trying to activate here through the front, but also really on the back and down that spine. If you want to let go of the chair, just bring your arms down to the side. If you want to add more intensity to this, back up next to the ears. Exhaling to lift back up, focusing on the back of the body. How about 3 more there? Focus on those muscles you're using. Exhale to lift, inhale to lower. No rounding of that spine and keep the shoulders down. All right, one more. We're going to add just a little bit of pulsing to this one, all the way down. I want you to come maybe halfway up through your range of motion. Back is nice and straight. Using the back of the body, we're going to pulse it up and down, just an inch or 2. The chest is wide, the elbows are wide, the shoulders are relaxed, and make sure you're breathing. How about 4 more there? You're almost done. Here's 3, 2, last one. Go all the way down to the floor. Let your hands hang down. Take a breath, and we'll finish with just a couple stretches. Now I want you to bend and flex through that spine. So we're going to slowly roll ourselves up, 1 vertebra at a time, feeling that good stretch through the back. Sit it tall, draw the shoulders down. Go ahead and reach up as tall as you can. Think about reaching to the ceiling, dropping the shoulders down, and lengthening through those abdominals. Good. From here, we're going to bring the arms out to the side. Let's get a little twist to one side. Bring your hand to the thigh, and your opposite hand can go to your chair. Think about looking over that back shoulder. Take a breath and release it. Arms will come back up to the side. Twist it to the other side. Hand on the thigh, opposite hand back. Looking over your shoulder. Remembering to breathe. Let's bring those hands back up. Twist to the side. Finishing with one more stretch side to side. Let's reach nice and long. Dip it down to one side. Shoulders are relaxed. And all the way back up. Other side, exhaling. This one should feel good. I want you to think about the lengthening sensation along the opposite side. And last one here. Bring those hands back up and release. You are already finished with your seated core workout. For more fitness and workout ideas, be sure to visit sparkpeople.com. Hi, I'm Coach Nicole from sparkpeople.com. In this video, I'll lead you through a cardio routine that you can do from a chair. Hopefully you're using a chair that doesn't have wheels for safety and one that doesn't have arms so that the arms don't get in the way of your movement. So doing cardio from a seated position is a challenge. I want you to follow along to the best of whatever your ability level is. If you need to go slower or go faster or change the range of motion to do whatever works for you, then that's what I want you to do. So we're going to get started by scooting up to the edge of our seats and starting to warm up through the lower body and the upper body. So hands on the thighs, and we'll just lift and lower the heels to start. So keep in mind that there is no right or wrong way to do any of these exercises. Think of them as suggestions to you, and then you find the appropriate exercise or movement that does work for you. A few more here. And now we're going to tap those heels forward. We'll go heel, toe, heel together, switch sides. And here we're just kind of lengthening through that leg, warming up more through the lower body, but also through the ankle joint. And remember, you can slow this down or speed it up to suit your needs. Couple more there, one more time on each side. And then we'll bring it to a little march in place. So if you're only using upper or lower body, that's totally fine. Just use the suggestions that I'm doing for you here, okay? So a little bit taller, we're starting to breathe a little bit heavier. Coming up, we're going to start warming up more through that upper body. I want you to think about swimming through water, okay? So we're gonna swim it out and in any kind of direction that works for you. I want you to think about various ranges of motion. If you wanna lengthen the legs here, you can, but try to get it in different directions and really warm up through those shoulder joints and the upper body. Get a little bit of torso movement into this as well. Okay, marching or extending those legs out. Try a couple more in another direction. And then we're just about warm and ready to go. Bring your hands back down to your sides. And I want you to imagine you've got a soccer ball between those feet and you're just dribbling it side to side. You can take this slower if you need to. If you want to add a little bit of upper body, just do what feels natural for you here. You can move in all kinds of directions with the arms and the torso. We just want to avoid leaning back into that chair. Try to use those posture muscles. Good, couple more here. Keep passing that ball or dribbling that ball in front of you and bring it back. Make sure you're still at the edge of your seat. We're gonna bounce the legs and pretend you've got a basketball now, where we're gonna punch it forward as if you're gonna pass to someone in front of you. So slow this down or speed it up for what works for you. From here, a little bit quicker, a little more intensity, just for 8. Ready? Little bounce if you can with the legs. Here's 4, 3, 2, 1. Now we're going to take it up, bringing it back to just the heel raise again, reaching as high as you can. Now let's take it a little more intense. You can increase the speed or the range of motion to do that. 4, 3, 2, 1. Now down to the floor. Think about really pressing through those arms, activating as many muscles as you can and up that intensity. Here we go. Whatever routine works for you. Just feel what feels most natural. Good, now we're gonna go to one side. Notice how I'm twisting a little bit from the waist, passing that ball to the side. Good, now a little more intensity, bouncing or speed, maybe a combination of both. 4, 3, 2, 1, other side. Get that rotation through the waist. The more muscles you can use, the better here. That's what's gonna get your heart rate up. And speed or intensity right here. Here's 4, 3, 2, 1. Now we're gonna imagine we're boxing. So I've got that little boxer shuffle with the lower body. My upper body is engaged, core is nice and tight. Let's add a little speed bag move to this. So we're just circling the fists. And right now we've got it in front of the chest. Now from here, I'm gonna rotate to one side, continuing with the circles. Make sure you're breathing and find a speed that works for you. Let's bring it to the other side. Good, still about chest or shoulder level with those hands. Now we're gonna take it taller, out in front, above the head. Still shuffling with the lower body. Good, strong arms here, to the side again, nice and high above those shoulders. And let's get ready for that other side, swing it around. Almost there, 4, 3, 2, 1. Bring those hands back down. You're at the edge of your seat. We're going to step forward with this left leg. Forward and back. So I've got the arms bent. We're lengthening forward. Notice my lean to the front and to the back. How about 4 more like this? Then we'll make it just a little bit bigger. Coming up, I'm going to straighten the arms and the leg a little bit more, okay? Arms are going to lengthen out and in. Nice and straight with your back. You can make this a little quicker if you need to. 4 more. Shoulders down, abs are engaged. Here's 2. Getting ready for that other side. Bring it in. Now tap it forward and back. Add a little bit of lean with that torso. Remember, to get that heart rate up in a seated position, you've got to engage as many muscles as you can. So by increasing your speed or your intensity, that's how to do it. Let's lengthen it out now. Just reaching a little further, keeping the abs in tight. Remember to use that deep breath. A few more here. Here's 3, 2, last one. Bring it back to center. We're gonna twist. And you can do whatever kind of arms here work best for you. So I've got my feet on the floor and we're twisting to opposite sides with the knees and the hands. But if you want to add a little more of a hop to that, a little bit of a deeper twist, bigger arm movement if you want, hands further away from the body. Make sure you're breathing. 4, 3, 2, 1. Hands are back down. Let's work that lower body a little bit with some kicks. Just lengthening out. Alternating sides. All I'm really doing here is lifting the back of the thigh a little bit away from your chair and then just straightening the knee. Think about your toes pointing up toward the ceiling. But remember, this can be lower. You can keep your heels on the floor if you need to. Good, find an intensity that works for you. Let's get ready to add some arms. We'll add some jabs to this. So the opposite arm and the opposite leg that's kicking. All right, as soon as you're ready to go, bring it forward. So I want you to think about some intensity in those arms, really punch and pull. We need to use those arms to help us elevate the heart rate and get the most benefit out of this exercise. So legs are strong and arms are strong with that punch. Make sure it's not just a push forward, but it's also a pull back, really engaging through the back. A few more here. Let's give this a little bit of an intensity burst, a little quicker. Good, put a little more power and intensity into it. Just for a few more counts. 4 more. 3, 2, 1. Now we're gonna go right to a reach overhead. And I'm adding that lower body, just a tap to the side. That can be smaller if you need it to be. But the bigger you can make this movement, the more you're gonna get that aerobic and calorie burning benefit. So notice I'm leaning a little side to side too, but keeping the shoulders down and the back nice and straight. We're still far away from that chair back. Good, keep reaching tall. Think about your fingertips and your toes going to opposite sides of the room as you're lengthening there. Almost done here. All right, we're down to our final exercise, modified jumping jack. Tap one foot at a time. I've got the elbows bent here, just going up to shoulder height and back down. This can be a little quicker or a little slower, depending on what works for you. But I want you to think about those arms being really strong. If you can up the intensity, instead of doing a single leg, we're gonna do it like a real jumping jack. Both legs coming out at the same time. Here we go. Getting a little more of a hop into it. Arms are strong, back is straight, sit as tall as you can. And again, one more chance to up that intensity on this final exercise. Instead of keeping the elbows bent, we're gonna straighten them out and make that arm movement even bigger. All right, this is your final few counts. Here we go. As big as you can, as much intensity and speed as you can add to this exercise. This is the final component. Keep breathing. 8 more. You're almost there. 4, 3, 2, 1, and march in place. We want to take a moment to not just stop our activity abruptly, but we want to gradually slow it down and bring down the heart rate. So I'm still at a fairly quick pace right now, but it's light activity compared to that jumping jack. So I'm going to start to slow it down, make it a little less intense, make my foot smaller, make my arm movement smaller, and then we'll bring it back down to no arms, just a little lift and lower with those heels. Think about breathing deeply. You should feel your heart rate already starting to come back down to a resting level. Take a few deep breaths in and out. And exhale. 1 more like that. If you need more time, if you still feel like your heart rate is elevated too much, take more time with this little march in place. Otherwise, we're going to move into a few seated stretches. Let's extend the legs out as much as you feel like you can. Little bend is okay. We're going to reach tall, pull the belly in really tight, and then collapse over those legs. From here, I want you to feel a good stretch not only through the back, but through the backs of the legs. The more you straighten through the knees, the deeper you'll feel that stretch. Make sure you're breathing steady. Let's bring the knees back in, or the feet back in under the knees. Pull your abs in and slowly roll yourself back up. Draw the shoulders back, take a deep reach high to the ceiling. And exhale 1 more time just like that. Inhale, reach. And exhale back down. Let's get a couple arm circles all the way back. Stretching out through that upper body and reverse it. Take it forward for 2. Last one here. And release those hands down. Great work. You are finished with your seated cardio routine. For more fitness ideas, visit sparkpeople.com.